Good evening, wherever you are. This is Diego Vale from ConferenceHype. From the July 2026 edition of Blood Cancer Journal, this journal review looks at WNK2 oncogenicity revealed by the discovery and functional characterization of novel gene isoforms in MYD88 mutated Waldenström's macroglobulinemia. Background: WNK2 is a known tumor suppressor in a set of solid tumors, including glioblastoma multiforme and pancreatic ductal adenocarcinoma. Methods: WNK2 functions are largely unknown beyond the kinase domain-dependent inhibition of ERK1/2 signaling. Results reveal an undocumented oncogenic function for WNK2 driven by novel, cancer-specific isoforms and provide a framework for its further investigation as a determinant of disease progression in MYD88 mut WM and a novel therapeutic target in hematological and solid tumor oncology. Discussion: although not expressed in healthy B cells, WNK2 is a top dysregulated gene in MYD88 mut WM.
This is ConferenceHype. Stay with us, coverage continues.
Hi, Lennox is covering archives of disease in childhood. The topic is parent-to-parent recommendations for coping with congenital heart disease, a mixed method study. Background: of acknowledging challenges but focused primarily on imperatives to move forward. Empower yourself with information and support. Take care of yourself. Trust your medical team, your child and yourself, and maintain a positive outlook on improvement and believe that normalcy is possible. Methods: setting, standalone children's hospital. Results: parents recommended balancing tactics for taking control with strategies for adapting to uncertainty. Discussion: recommendations from parents provide direct advice for others facing new diagnoses and outline actionable steps for clinicians hoping to support those receiving a CHD diagnosis.
This is ConferenceHype. Stay with us, coverage continues.
Novaquin is covering archives of disease in childhood. The topic is autism in children and young people with functional tic-like behaviors, a retrospective cross-sectional study. Background: functional tic-like behaviors are characterized by multiple, complex vocal and/or motor tics, typically with adolescent onset. Methods: the study comprised 63 children presenting to the Great Ormond Street Hospital Tic Service between August 2020 and May 2022 with an FTLB diagnosis. Results: in the FTLB sample, 69.8% were diagnosed with autism and 37% had Tourette syndrome, both much higher than in the general population. Discussion: there is a high prevalence of autism in patients with FTLB.
This is Conference Hype. Stay with us, coverage continues.
McCrusher is covering archives of disease in childhood. The topic is CRAFFT study, wrist fractures in children. Background: there were no randomized controlled studies examining the management of a very common injury in children, the wrist fractures. Methods: the observational case series described the well-known feature of children and RSQO-S fractures, that they have an amazing ability to remodel marked deformities of the wrist as the children grew. Results: the usual practice was, however, surgery. Discussion: there was a classic absence of evidence to inform management guidelines. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X.
This is Conference Hype. Stay with us, coverage continues.
Vesper Quill is covering archives of disease in childhood. The topic is measuring transition success from pediatric to adult epilepsy services and its association with seizure outcomes, a UK retrospective cohort study. Background: objectives: to develop a working definition of successful transition from pediatric to adult epilepsy services, assess transition success, identify predictors, and determine whether success is associated with improved seizure outcomes in early adulthood. Methods: retrospective cohort study. Results: of 59 eligible patients, 72.9% achieved successful transition. Discussion: a novel transition success tool was developed.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors.
Ryan Reed is covering archives of disease in childhood. The topic is pediatric colchicine poisoning in the UK, a 10-year retrospective case series from the National Poisons Information Service. Background: colchicine, derived from autumn crocus, has been used for centuries to treat arthritis. Methods: a retrospective analysis of telephone inquiries regarding colchicine to the National Poisons Information Service recorded in the UK Poisons Information Database. Results: over the decade, 57 cases were reported to NPIS, yielding a minimum incidence of 0.41 cases million children year. Discussion: colchicine overdose in children is infrequent but can be fatal.
This is ConferenceHype. Stay with us. Coverage continues.
Riley Knox is covering archives of disease in childhood. The topic is disagreements over medical treatment. Background: clinicians and parents do not always agree with respect to the medical treatment of a child. Methods: one, but it is rarely necessary to resort to an early court application for resolution. Results: can the common law illustrate circumstances when an early judicial review might be justified? Discussion: we have had recent regional inquiries, two concerning parents seeking ostensibly unusual treatment for their inpatient child, parents refusing to disclose the diagnosis of malignancy to their competent child, and a family refusing to disclose to their teenager that she was dying. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X.
Conference Hype. Stay with us, coverage continues.
Unavail is covering archives of disease in childhood. The topic is value of blood pressure for detecting serious illness in children attending acute care settings in low and middle-income countries, a multicenter observational study. Background: in children, the value of routine blood pressure measurement in first assessment at the emergency department has been questioned. Methods: this observational study is based on data from children attending 3 acute care settings in the Gambia and Suriname. Results: 2,185 visits from Gambia rural, 398 visits from Gambia urban, and 1,817 visits from Suriname were included. Discussion: our results do not show a significant association between hypertension and serious illness in LMICs. This is Conference Hype. Stay with us, coverage continues. Grant Ivy is covering archives of disease in childhood. The topic is Guide to Understanding Observational Studies that use real-world data. Background: on real-world data itself and observational studies, both the advantages and the disadvantages of using RWD for observational studies, and how to critically appraise these studies. Methods: the contents of this article provide a brief background on real-world data itself and observational studies, both the advantages and the disadvantages of using RWD for observational studies, and how to critically appraise these studies. Results: other articles in this series will then discuss specific analyses applied to RWD, such as interrupted time series, difference in differences, and the role of RWD in randomized controlled trials. Discussion: RWD is defined as data that was not primarily recorded for research purposes, usually as part of routine healthcare.
This is Conference Hype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. Alina Park is covering archives of disease in childhood. The topic is what is in a name, the Supreme Court, and anonymity. Background, introduction and application can be made to the Family Division of the High Court to invoke its inherent powers to withdraw life-sustaining treatment to a child. Methods: there has been an increase in the number of cases attracting national and international media attention, too with a corresponding concern surrounding the impact on clinicians called as witnesses in these proceedings. Results: while all parties seek to keep the child at the heart of the proceedings, there is also a risk to witnesses of abuse and harassment. Discussion: to date, the High Court has provided wide protection of the anonymity of the child, clinicians, and treating organization through a reporting injunction. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X. Benji Cross is covering archives of disease in childhood. The topic is non-therapeutic male circumcision, a clinical and legal perspective on minimum standards of practice in the UK. Background, introduction: male circumcision may be performed for clinical reasons or to comply with religious or cultural practice. Methods: non-therapeutic male circumcision is not uniformly available in the NHS, but is undertaken, generally by highly skilled circumcisionists, in non-clinical settings in children without general anesthesia. Results: this is authorized on the basis of a best interest decision and parental consent. Discussion: there are occasions, however, where failure to adhere to minimum clinical standards of care in these settings has led to patient harm. This is Conference Hype. Stay with us, coverage continues. Sophia Reyes is covering archives of disease in childhood. The topic is a small but welcome light on the child-adult transition in epilepsy. Background: the transition and then transfer from child to adult neurology represents one of the most consequential and underexamined junctures in the long-term management of epilepsy. Methods: for young people with epilepsy, this handover is not just administrative. Results: the stakes are high as this handoff represents a period of profound clinical vulnerability during which continuity of care, therapeutic relationships, and seizure control can be compromised. Discussion: one, given its import, it is sobering that we still lack true consensus on what a successful transition looks like, let alone robust evidence regarding whether we are achieving it for our patients.
This is Conference Hype. Stay with us, coverage continues.
Miles Carter is covering archives of disease in childhood. The topic is atoms. Background: he and R-Squo D worked hard and L-Squo burning the candle at both ends in R-Squo, as his parents described it. Methods: poring over the set if fusty reference books he and R-Squo D loaned, ransacking the dusty shelf of the high street library, the lady at the desk raising eyebrows as she stamped the backpack-sized pile of tomes. Results: still, he and R-Squo D set himself a target, at least a B, a grade which would unfetter him from scholastic thoughts for the summer. A summer in which, after earning some money on the farm, he could fill with a trip to the West Country, the new loco from Paddington, the ideal start point. Discussion: pressing the point, one though still relatively hot off the press, the Phoenix sepsis score will by now be familiar to most.
This is Conference Hype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors.
This is ConferenceHype. Stay with us, coverage continues.
From the November 2024 edition of Annals of the Rheumatic Diseases, this journal review looks at positive feedback loop PU1-IL9 in Th9, promotes rheumatoid arthritis development. Background, objectives, T helper 9 cells are recognized for their characteristic expression of the transcription factor PU1 and production of interleukin 9, which has been implicated in various autoimmune diseases. Methods: the expression levels of PU1 and IL9 in patients with RA were determined by ELISA, Western blotting, and immunohistochemical staining. Results: the upregulation of IL9 expression in patients with RA exhibited a positive correlation with clinical markers. Discussion: these results support that the PU1-IL9 axis forms a positive loop in Th9 dysregulation of RA. From the November 2024 edition of Annals of the Rheumatic Diseases, this journal review looks at ACOD1-mediated inhibition of aerobic glycolysis, suppresses osteoclast differentiation, and attenuates bone erosion in arthritis. Background, objectives, metabolic changes are crucially involved in osteoclast development and may contribute to bone degradation in rheumatoid arthritis. Methods: itaconate levels were measured in human peripheral blood mononuclear cells of patients with RA and healthy controls by mass spectrometry. Results: itaconate levels in PBMCs from patients with RA were inversely correlated with disease activity. Discussion: ACOD1 and itaconate are crucial regulators of osteoclast differentiation and bone loss in inflammatory arthritis. From the November 2024 edition of Annals of the Rheumatic Diseases, this journal review looks at rheumatoid arthritis patients harbor aberrant enteric bacteriophages with autoimmunity-provoking potential, a paired sibling study. Background, objectives, viruses have been considered as important participants in the development of rheumatoid arthritis. Methods: fecal samples from 30 pairs of raw and healthy siblings that minimize genetic interferences were collected for metagenomic sequencing. Results: the composition of the enteric bacteriophagome was distorted in raw. Discussion: this study provides new insights into enteric bacteriophagome in raw development.
This is ConferenceHype. Stay with us, coverage continues.
From the November 2024 edition of Annals of the Rheumatic Diseases, this journal review looks at association of rheumatoid factor, anti-citrullonated protein antibodies, and shared epitope with clinical response to initial treatment in patients with early rheumatoid arthritis, data from a randomized controlled trial. Background: sufficiently strongly to warrant implementation in clinical practice. Methods: patients with treatment-naive early rheumatoid arthritis were randomized in the NORD-STAR trial to ACT, certolizumab pegol, abatacept or tocilizumab, all with methotrexate. Results: in total, 778 patients were included. Discussion: based on this randomized controlled trial, abatacept treatment was associated with a better response than ACT in the RF and or ACPA-positive subgroup at 24 weeks, but this was no longer seen at 48 weeks. Adding SC allele-related genetic markers did not strengthen the association. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X.
This is ConferenceHype. Stay with us, coverage continues.
This is ConferenceHype. Stay with us, coverage continues.